Hello and welcome to India TV. You're watching HealthDNA. I'm Shivangi and today we have with us Dr. Shiba Kalyan Biswal, Senior Consultant, Department of Pulmonary and Sleep Medicine, Fortis Hospital. Hello sir, welcome to India TV.
Thank you.
Sir, what is pneumonia and when can we define that a person is suffering from pneumonia?
So, pneumonia is basically an inflammatory condition of the lung in which the infection leads on to accumulation of fluid or pus inside the alveolar sac, which leads to difficulty in oxygen exchange or carbon dioxide release. So, this leads to the difficulty in breathing or other symptoms which we can find in pneumonic patients.
So, what are the different types of pneumonia and their causes?
So, pneumonia can be classified according to the setting in which the pneumonia happens. Similarly, it can be differentiated according to the cause of the pneumonia. So, according to the setting, if a patient acquires a pneumonia within the community, so we call it community acquired pneumonia. If in the hospital a patient acquires any pneumonia, it is called hospital acquired pneumonia. Similarly, a patient who is on ventilator, he develops pneumonia, we call it ventilator associated pneumonia. This is as per the setting. Similarly, if a patient develops pneumonia in the community, it can be virus related, bacterial related or fungal related. It is according to the etiology that we classify pneumonia, viral, bacterial or fungal.
Okay. And when we talk about symptoms, what are the most common symptoms of pneumonia?
So, coming to the symptoms usually the common symptoms include fever, which may be high grade associated with chills. Similarly, cough with or without any mucus production, and patient might be having extreme fatigue or he might be having weakness. Along with some patients like elderly and children, they might be drowsy, so that their alertness decreases. These are the most common symptoms. Rarely some patients may have diarrhea or vomiting.
How can one differentiate between pneumonia and seasonal cold and flu?
So, usually pneumonia and seasonal flu both have fever, both might be having generalized weakness and body ache, but when we see a patient with flu whose symptoms are not resolving within a stipulated duration of 5 to 7 days, and similarly along with it, if we find that he is having any breathing difficulty, any chest pain, any generalized drowsiness in his sensorium, then we might suspect of having pneumonia instead of flu.
Okay. So, are there any risk factors that make certain people more susceptible to pneumonia?
Obviously, there are certain risk factors which are associated with pneumonia. Most commonly is the age group. So, the children who are less than 5 years or the elderly who are more than 60-65 years, they are more prone to infection because they have their immunity is a bit weaker. Similarly, patients who are already having any underlying chronic diseases like diabetes or any chronic lung, heart, liver or any kidney disease, these people are obviously more susceptible to get a infection.
Sir, what are the diagnostic tests related to pneumonia and how accurate are they?
So, coming to the diagnostic test, on the OPD basis, when we see a patient suspected to be having community acquired pneumonia, we usually check for some vital parameters like fever along with oxygen saturation. So, pulse oximetry, which has been very commonly used as of now after the COVID times, it can detect if a patient is having any oxygen desaturation or not. If the oxygen desaturation is less than 90%, then we can obviously suspect someone having pneumonia, and in that case we can always go for a chest x-ray. So, chest x-ray is a basic investigation which can be done for any patient suspected to having pneumonia, and obviously chest x-ray has a low sensitivity, but it has a sensitivity of around 35 to 75%, and other blood tests which can be done to look for is the blood urea and serum electrolytes and blood counts. So, these can give us a suggestion if the patient needs in hospital admission or any ICU admission as per the reports.
So, sir, can we prevent pneumonia by vaccination?
Obviously, there is a very strong evidence in prevention of pneumonia with vaccination. So, vaccination for pneumonia is of two types. One is for your normal flu or influenza and other is for pneumococcal disease or bacterial pneumonia. So, as per literature, the flu vaccine is effective in around 60 to 70% of the patients in preventing the disease. Similarly, in for patients who are given pneumococcal vaccination, they can prevent invasive or serious illness in around 60 to 70% of the cases.
Sir, if we talk about treatment, then what are the recommended treatments for pneumonia, and do you believe that antibiotics are always necessary?
Coming to treatment of pneumonia, obviously when a patient gets symptomatic with fever, cough and other symptoms, so symptomatic treatment is always advised, and antibiotic, obviously if the fever persists along with we have a pneumonic patch, then we have to consider oral antibiotic to start with on an OPD basis. But if the patient is ill, then we have to consider IV antibiotics. Obviously there are 1/3 of cases which might be viral, and in those cases obviously antibiotic is not recommended, but other cases we have to give oral antibiotic or IV antibiotic as per the severity of the disease and the setting of the patient.
Sir, how long does it take to recover from pneumonia?
Usually it takes around 2 weeks in routine patients, because ideally the antibiotic is given for 5 to 7 days, and around another week we need a patient to recuperate with the illness. But if any serious illness is there, if a patient has been admitted in the hospital, has been in the ICU for some time, then it might be longer, maybe up to 4 weeks also.
Are there any complications that people must be aware of?
Obviously pneumonia has its complications. This is the reason it is considered as one of a serious illness. So to start with, pneumonia will definitely lead, if not treated on time, to respiratory failure, so which can lead the patient to be taken to ICU requiring oxygen support along with some ventilatory, maybe invasive or non-invasive. Similarly, the patient who have not been treated on time, they might develop other complications like fluid in the lung, which we call is pleural effusion, which can get super added infection, which can lead to empyema, lung abscess, and even that infection can spread to the bloodstream and cause bacteremia, and finally this can lead to your sepsis and septic shock. And this is how this is the way it progresses and can lead to mortality also.
Okay. So sir, is pneumonia contagious? Can it spread from one person to another?
Yeah, most of the infectious pneumonia like viral and bacterial are contaminated with the droplets. So what we always suggest patients is to isolate themselves mostly so that during the initial phase of the illness. And similarly, we always suggest patients who are having suspicion of pneumonia to use mask at home as well as to isolate themselves and not to share personal belongings with family members. And obviously those who are suspected to having any flu-like illness or suspicion of pneumonia, they have to avoid public places so that it doesn't spread faster.
So given the present situation in Delhi NCR, you know that pollution is already becoming a very big problem. So do you think that pollution is affecting the incidences of pneumonia?
So definitely the quality of air in Delhi NCR has been very severe. So it is the incidence of pneumonia per se may not be that high, but the severity of illness might increase because of the poor air quality.
Okay, so that means that pollution in Delhi is also affecting people with pneumonia and making it more susceptible,
Yeah.
right? So on World Pneumonia Day, what would be your message to the people?
On this World Pneumonia Day, I would like to tell that everyone can get pneumonia, but there is a certain group of people who are at high risk of severe disease, and definitely pneumonia can lead to mortality. And if vaccine is available for prevention of pneumonia, we can always use this option of getting vaccinated and preventing pneumonia.
Okay, sir. Thank you so much.
Thank
Thank you for joining us on
Thank
India TV.